Hevert, effective by nature.
A couple of points that I want to tell you about is always having contact with your patient. If you're out here and the only thing that they feel is a needle coming at them, that's not a comfortable position. I always have my hands on or my body on and near the patient so that they feel me. They know that I am here, that I am part of it. Also, your ergonomics of your body. If you're in a bad position, your back's going to go. So bending your knees, getting down and getting your body, or lifting your table up where you're not in an antalgic position where it's going to bother you. For the sub-Q injections, a close-up here just to show is that if we want to be able to create that bleb, you're going to be at about a 45-degree angle with that syringe. It's easier with the smaller syringe. These larger syringes, obviously, it's going to be a little harder. But if you're at a 45-degree angle, obviously you're not going at 90, and you're not staying too superficial. But about 45, you go under and you're going to be able to lay that bleb. Your goal is this size of a bleb. For the adrenal injection, this is a 90 degree. Also be thinking about 90 degree with most trigger points. Depends on the depth that you want the trigger point. You may end up going to 45 in some instances, but for these, it is a 90 degree straight on, point to point. These are sub-Q injections. You could use a mesotherapy nappage point to point, but I like the sub-Q in laying down blebs. I'm going to start on the cervical, and we're going to start right up here, okay? And these are going to just feel a little stingy. I'm palpating the central spine, and the closer you can get to over the facet where the neurological where the nerve bundles are, that's kind of your guide. Without a fluoroscope, hard to do, but if you can palpate it, that's what you really want to do. Okay, here I go, and any of these that would be tender would be great points. Here we go, little pokes. And remember, the quicker in, the faster in I go, the less it hurts the patient. How are you doing? Okay, doing good. Poke. Again, trying to stay maybe 1.5 centimeters. It depends on the patient. You got to palpate ahead of time. How close to the spine? You're either going to be 1 to 1 centimeter, maybe farther out. Again, your patient's body and morphology is going to dictate that. I'm creating little, maybe 0.5 centimeter blebs. Doing okay? Now, if I distract, if I find my point, not only am I distracting her and desensitizing it for the medication, but I'm finding a better spot to inject. And you can see with this particular type of needle and syringe, I'm losing a little bit of medicine. You would prefer to use ones that do not, but it's okay. Okay, here we go. And a little farther apart, obviously, because of the anatomy, thinking about like even trigger points, finding any that feel a little more edematous, those would be great places to inject. You doing okay? Yes. Okay. So when you start going faster and kind of know your landmarks, then you can go fairly quickly and the procedure does not take long. You let me know if you need a break, okay? Good. Doing good. All right. In general, I would prefer it as I lay down these blebs that I would not have any of the medication sitting on top, but it's okay. It is, and it will eventually reabsorb as much as it can, but I would prefer to not lose any of the medication. And that is a good teaching point for choosing your syringes and needles appropriately so that you're not losing it. Right now, I'm going to start distracting with my finger. I'm pulling back so that I can hold on to the medication. You shouldn't have to do that. But now, if you want to stay as superficial as you can, the bevel up on your needle would be a good way to do it. You still doing okay for me? Yes. All right. Again, check yourself on the spine. If you get a scoliosis going, all of a sudden you'll be going down and you think, uh-oh, I got off onto the wrong place. So keep checking that spine to see where you're at. You may have to curve with the spine itself. As you are working on the patient, they're going to be more sensitive the more lateral you go and also the farther down you go. So now I start saying, okay, these will be a little bit more stingy, and you can see her have a little jump sign there. And that's why I save these for last, so that you don't run from me, right? The first ones didn't hurt that much, right? And these get a little stingy, and it's just because of where I'm placing it. It's not because of anything going wrong or a problem with the medication. It's just stingier down in here. There's more nerve endings and more sensitivity. If you think you've gotten too far or too wide, go back, re-inject. It's okay. You're not going to go, you're not going to not get an effect, but the closer to the areas that you want you are, the better the treatment will be. So how are you doing? It's okay? Was it too painful?
No.
No. I would let that absorb before I would go to the adrenal glands, but for the purposes of this video, I'm going to go right into the adrenal gland treatments. This particular one, now I'm using just a 3 cc syringe. I have 1 amp of Calm Valera. As I talked about before, my purpose is to really work with the adrenals, especially adaptogenically. An anatomy lesson again for us all. Somebody's adrenal glands could be up in here, one patient, the next one could be lower. Her rib cage is very low, so she's a little bit more inferior than you would think. So always continue to palpate the body. Don't assume where you think it should be. So in this case, I am going to visualize and assume that those adrenal glands are about right here. In most patients, I think it would be a little bit higher. But for this patient, we're going to do it. Now, you can use betadine or alcohol. Because we're using a point-to-point nappage, very tiny needle, it's really, in my opinion, not worth using the betadine. Alcohol is fine. Okay. Now these are going to be a little jumpy, okay, and I'm just going to go around in a circle like this. Again, the more the patient knows what you're doing, they feel it. They felt my hand, not just the first thing they felt was a needle, so that they're prepared. And I'm distracting. I'm actually prepping that skin so it's not quite so sensitive for her. Okay, and I'm just going to go right in little circles, all right? Again, I could do a little sub-Q blebs like I just did on the back, but for our purposes today, I'm going to go straight in. Here we go. And these might be, because of the meso needle, a little stingier. Doing okay? And watch my distraction technique. If she's feeling this, she may not feel the needle as much. That's the purpose. About 1 to 1.5 centimeters around. It doesn't take much medication. Again, if you're not sure that you're in the area, I could go around and go a little bit larger just to make sure I've covered where I want. So I'm making an outside circle now in between the last injections that I just did. So I've covered a fairly large area, and you can see her jump whenever I got to the lateral side. Again, that's just because of where it is. When the farther out here I go, the more tender it's going to be. You okay? All right, now we're going to do the other side. This particular needle, these mesotherapy needles, can be a little jaggedy. They're a little more tender. I would have preferred, and I like to work with my 30 gauge 1.5 inch needles to do this technique. But these are great ways to learn when you're trying to stay shallow. So good place for you to do, but after you're done with this, your patient won't be jumping as much because at 30 gauge don't hurt as much. A few supplemental therapies that I would also recommend for this patient would include the Hevert Stress Relief Tablets, the Hevert Gastrointestinal Relief Tablets, the Hevert Detox Liver, and the Hevert Detox Lymph. That will be addressing the GI complaints, and the lymph in particular, the sluggishness and some edema complaints. Nutritional suggestions that you can consider are vitamins B and C. The Hevert practitioners really recommend the vitamin Bs with the homeopathics, and that's due to their years of experience. I personally would recommend adrenal glandulars if there's no autoimmune disease, and also an adrenal herbal product if there is autoimmune disease in the patient. Laboratory and physical exams that you may consider for this patient include identifying any underlying GI pathologies. I would be running a GI test, specifically IgG test, food sensitivities, looking for those delayed sensitivities, identifying any permeability problems, thus leaky gut, which most of these patients have, and yeast and or parasites. I would be running an AM and PM cortisol. You can use salivary, but if they have insurance, I use AM and PM cortisol to look for those night-day differences and helping me in my protocols. And in the office, every patient that comes in, my medical assistant automatically does an orthostatic hypotension, blood pressure on them. If that's dropping like a lot of these patients are, then I would also be identifying and charting a slow pupillary response. In an adrenal fatigue patient or those in burnout syndrome, the last thing that we should be recommending would be some kind of exercise that really exerts those adrenal glands. Yin restorative yoga, stretching, and any exercise that they enjoy that doesn't overexert them would be the perfect recommendations. I'm a proponent of meditation, but I'm a proponent of active meditation. Very difficult to tell a patient to go quiet your mind and quit stressing. What are they going to do? They're going to be mad at you when you first say that. So active meditation, breathing types of meditation allow that patient to learn how. Also music. Music is a wonderful way. Whatever their type of music that they enjoy and they relax to, don't forget that music is medicine and non-invasive, and that's something you can remind your patients to do as well. Obviously, if they're struggling with severe depression, counseling may be needed and you will do the appropriate referrals. I've enjoyed making this video with the Hevert team and hope that these injection techniques and clinical pearls will help you in your practice. The fact that we have less concern about contraindications from the medicines themselves makes it easier to implement and incorporate into your current treatments. Remember, as with any type of injection, the same contraindications should be heeded, such as blood thinners, diabetes, and pregnancy. I wish you much success utilizing these in your practice and that you experience the efficacy that I have. As defined by our titles as physicians and doctors, we are healers and teachers for our patients. Thank you and enjoy your work.
Hevert, effective by nature.